The clinical results, to date about 12-year results are available for the PCL sacrificing, the retaining ones, and the results are almost similar. Another philosophy was introduced, which was a rotating platform. The theory behind that was because there is more back surface wear with the fixed bearing implants. So the thought was that if the polyethylene liner rotates on the tibial tray, maybe there will be less wear. But to date, again, we haven't seen a substantial difference between this and the conventional sacrificing ligaments. Now, knee replacements that are available today have given us extended durability. The reason for that is the polyethylene that is used today is different. The one we are using today is known as ultra high molecular weight polyethylene, and that has almost revolutionized orthopedics, because the fatigue strength of this is very good. It is very less brittle. To give you an example, we as orthopedic surgeons consider professional skiers to abuse their knees. It's good to do something in moderation, but if you do it too much, then it can bounce back on you. So the ultra high molecular weight polyethylene that is being put in skiers was studied, and it showed it wore almost 0.01 millimeter per year, and the conventional high density polyethylene wears 3 to 4 millimeters a year. So you can imagine the magnitude of difference, and that's why now with the newer polyethylene we see much less aseptic osteolysis or loosening of the implants. Furthermore, the knees available today give us more flexion, and the reason they do that is because we have shorter condyles and larger spaces over here that are
suspecting that this was a case of bilateral AVNs, which is
more flexion at the same time stable gait while the knee is flexed. So to conclude, knee replacements that are available today have improved the patient's functional abilities. There is much more consistency of clinical results, and the surgical trauma is also less, because now we've moved towards minimally invasive surgery. The newer designs, as we spoke, one was about polyethylene. The other is sterilization techniques have changed, because formerly these polyethylene liners were sterilized in air, and because of oxidation of the polyethylene surface, what happened was it made it more wear proof, and that's why now it is sterilized in either vacuum or in nitrogen based air, which has decreased the oxidation of the surface, and hence we have good results. And we are also using thicker tibial inserts to last longer, and the conformity also gives us more stability. Over the years, our perioperative management has also changed. Now we use multimodal pain control protocols, which include a variety of things, including epidurals and nerve blocks post-op, and these have decreased the rate of manipulation post-op, because stiffness is one of the major things, whether it's the west or east, wherever we may be practicing. Stiffness after total knee replacements can sometimes come back to haunt the orthopedic surgeon, but these changes have encouraged early walking, decreased inpatient stay, and obviously then the other medical complications like ileus and DVT also go down. If you look at the outcomes, it becomes a little different, because there are different implants and different patient populations. Then we may do them with cementless or with cemented fixation. And if you look at the knee registry data, which is a European based registry, and that showed an implant survival for knees at 7-year follow-up to be 95 to 99%. This was the early results. If you look at the results from the Swedish knee arthroplasty registry, where they have more than 50,000 primary and revision knees, they showed a revision rate of 25% after 18 years. And the risk was higher if it was a cementless. We are talking about knees. And if you look at the US registry, there only today they have 5,000 plus knees with 53 surgeons contributing. So that brings another variable which is difficult to control. But even they showed that cemented knees tend to do better than cementless ones, with a 10-year survival of more than 95%. Complications after knee replacement.